Another awesome feature of this PT400M center break point is the ability to have the patient lie side lying. Many of our patients, as we see, have pelvic obliquities with a predictable compensatory concavity or convexity acquired in the C-spine, along with adaptive shortening of the muscles on usually the long lower extremity side. That would be elevation of the right hip, causing side bending to my right, shortening my quadratus lumborum. So I'd have that patient lay on their left side so that I can take this center break feature to optimally position for release of that quadratus lumborum and perhaps even do intersegmental mobility testing side lying and identify segments that need to be mobilized and which segments then would also be assessed to be needing to be manipulated and or stabilized. So let's look at this break feature. I would have the patient side lying and I could position the portion of the thoracic or even lumbar by how I position the patient with optimal head support to get the fulcrum exactly to complement my side bending feature. From here, I could release quadratus lumborum. I could intersegmentally assess the segmental mobility. And again, this optimal feature of just simply moving the sliding armrest, now I am not extended at all. My spine actually is vertical, and I'm in a very ergonomically stable position to operate on the patient, and thus create optimal vectors of force. Speaking of optimal vectors, I must talk about this firm response top that is actually comfortable to the patient, yet provides me an end point from which I can make reliable assessments of joint mobility. This top also is designed for maybe longer treatment sessions than the traditional PT400 top that might be more for shorter treatment sessions. Hi, I'm here with Colleen, and I would like to demonstrate on the PT400M the ability to enhance side bending to affect either the thoracic or the lumbar spine. Colleen, let me ask you to lay on your side. If you'd lay on your back and roll this way, please. Sit and roll toward me and scoot up just a little bit, right there. And you can see for patient positioning, wherever I want to position her on this top could enable me to adjust the fulcrum on what area I would like to position. We call this ergonomic positioning for success, a unique feature to the design of Oakworks tables. This powered center break will enable me to side bend Colleen to her left, which is going to elongate these superior structures, such as the quadratus lumborum, and optimize my positioning for stretching her quadratus lumborum, the superior musculature above her spine. I could have her slide lower if I wanted to do thoracic spine. Colleen, I'm going to lower this first. Now let me ask you, if you don't mind, to slide down a little bit this way. Lift your head for me. There you go. Okay, now let's demonstrate the side bending feature now to make it more thoracolumbar or just thoracic side bending. And just let the table do the work. With this positioning, the table's relative height has increased, so I'm going to lower the table overall. The contoured top enables me to get very proximal to the patient, so I'm working vertically. I would not want to be working this way. My ability with this contoured top to come right in, and I could work on her thoracic spine accordingly. I could work on her shoulder girdle accordingly. This center break feature is unique to this PT400 feature that enables me to side bend the thoracic and lumbar spines based on my position of the patient. Again, positioning for success, key ergonomics to patient outcomes.